thought, wouldn't it be great if we gave something back to the community by organizing, which was quite trendy at the time, a flash mob. So at the Eaton Centre Mall in Toronto, we had about 300 dancers, none of them from our professional programs, all just people from the community, get together to dance. And as they were learning the choreography that was fun and accessible that we created, we realized that they needed some video support to practice at home. So we created these really cheap and cheerful online videos. And once we put them out there, we thought it was just for that group, but some public school teachers found them, started teaching their own students the dance. And that was a real light bulb moment for us, is that through digital media, we created an opportunity to scale up a program and reach out into a wider part of the community. So it went from being a one-off flash mob to something that we realized could be the catalyst for a whole suite of dance programs that promote health, that promote inclusion, that if we put our backs into it, we could really evolve over time.
And let's practice one of those things where you do a big hug. So we'll reach out, this is a good test to see that we're not too close to anybody. And then we'll soak up that energy and give ourselves a big squeeze. Yeah, it's nice to start the morning like that, right? We can do that again.
This project is about the challenges that older Canadians living with dementia face in terms of meaningful social engagement. And that's one of the biggest barriers that we know keeps people from having a good quality of life when they're living with dementia. And the project itself is unique because it's focusing on not just older people living with dementia, but also their caregivers, who we also know face significant challenges in terms of social participation and social isolation. But beyond that, we're also trying to examine how the program itself can be effective in rural areas which face significant challenges in terms of technology and transportation and so on. And we're also interested to examine how the program can be expanded or scaled up and actually run across rural Canada in different types of rural and small town places.
I'm a dancer. I know the physical and psychosocial benefits of dance because I've lived them, I feel them, and I know dance is fantastic, but that's not enough for the scientist, for the researcher, and it shouldn't be. That's why we are hoping to research both the physical and the psychosocial benefits to really be able to explain in more clearly why we know dance is so great for Canadians.
I think it's significant to be able to provide evidence for the impact that these programs have. We know that medical interventions are often required and important when you're dealing with certain symptoms that come with aging, but we believe and know that dance as a complementary therapy, or frankly just a positive regular activity, is something that can probably improve your quality of life and minimize your need for that sort of intervention from a medical side of view, and it allows you to stir your soul as well as you're promoting your health and moving your body. So having the evidence for that, which comes out of doing this kind of research, is really important in making that case to medical professionals, neuroscientists, and other people in the community.
So one of the real pleasures we have in having the pilot of Sharing Dance running here in the Peterborough region is that we've been able to work with Community Care Peterborough. 900 volunteers are running community care programs across this region. And one of the reasons that we're studying the pilot program here is to actually see how a really well-functioning organization like Community Care can teach us lessons about the best ways in which to run programs like this, what are the challenges in terms of making it work properly, and then we'll translate those across Canada where other community care organizations are also interested in running these kinds of interventions.
There's a recognition that in the same way that post-secondary institutions are the experts when it comes to research and the scientific method, the people who are delivering services on the front lines, some are small nonprofits, they are the experts in program delivery. And in that spirit of collaboration, for the Government of Canada to tap into the expertise that exists at all these different levels just ensures that we have greater success and better results.
There are numerous ways that the expertise and research that can be done by Trent can be used for us to make good decisions going forward. And we often think in the moment in our planning decisions, not into the future far enough. But if we have a vision, if we are assisted in understanding what the vision is going to look like, then we can make better planning decisions now for the future.
I think the most important message is that social inclusion is one of those dimensions that's often neglected when we think about what it means to live with Alzheimer's disease or related dementias, and what it means to take care of people who are in that particular situation. So funding and people who fund the Alzheimer's Society of Canada are allowing us to examine and actually have real impact on the lives of Canadians when they're facing those challenges.
Our motto, our mission at Community Care is to keep people active. It's proven that if you do active exercise, you feel better mentally and you feel better physically. I think it's a great opportunity for the Peterborough communities across city and county and all the residents to take part in this sharing active dance program.
The program has a huge impact on participants. Most of our evidence was anecdotal, but it was overwhelming and extremely positive. And so what's been exciting to date is now that we've been working in Peterborough County with other partners, we've been working in other parts of the country, we're seeing that enthusiasm, that quality of life improvement replicated over and over and over again. So for us, it was what we imagined would happen, but then to start to see it actually before our eyes is hugely encouraging and lets us know that we're on the right track. And our challenge really is, how do we make sure this program can scale in the way that we want it to, so that this great feeling that it brings to people's lives can just happen all over the Canada.
I think one of the great things about this project is that in design it's interdisciplinary and it's community-based, and that requires the development of very mindful relationships with partners and agencies and other researchers across the country. But that's also what we know works in rural communities when we're thinking about how rural communities are responding to challenges of rural aging and dementia and so on. They are innovating, they are integrating, they are finding different ways to develop partnerships. So in some ways we're emulating that model with our research design, and we're really excited about the potential to succeed.
It's important for the relevance of our own institution and our art form that people care about dance. And we found that almost all the people we've drawn into this program had very little previous dance experience, but because dance is now an important part of their life, they're quite interested in and appreciative of what our Olympic caliber students are able to do. The art form of ballet suddenly has way more relevance in their lives than it did before. So we also have a huge conviction that the more we can spread sharing dance, the more we will demonstrate the relevance of the art form as a whole, the more people will celebrate the rare talent that the exceptional students in our programs have. And frankly, for us, we can find talented kids out there who never believed they might have a future in dance, but they've never been exposed to it, and now they have that chance. So it's got huge potential for the future of the school.